Morning everyone. Indeed, you need a strong heart to be around here. But I'm sorry I can't dance. Anyway, my name is Mui Fong and I'm a pharmacist from SGH. Today I'll just be sharing a bit with you guys on... Wait, let me try to position. Alright. You can hear me, right? So, just be sharing a bit about medications commonly used in multiple myeloma, some side effects of the drugs, and how to manage the side effects. Okay, so myeloma, usually treatment is only indicated if the patient is symptomatic, and factors that affect treatment include whether the patient gets transplant or not, and to decide this, we actually look at various factors, including things like your age. If a patient is more than 65 years old, generally transplant is not really an option. And also we look at the patient's disease risk, whether it's standard risk, intermediate risk, or high risk. And then also other comorbidities that the patient may have, because for a patient to go through transplant, usually we want them to be as healthy as possible. So if a patient is actually eligible for transplant, they will actually go through a few cycles of induction chemotherapy, followed by stem cell transplantation after about 3 to 4 cycles. And transplant, either single or double, with satisfactory response, then they would actually undergo maintenance therapy with either things like your Velcade or lenalidomide, or if the patient actually unfortunately relapsed, then they might have to be retreated. So for induction chemotherapy, drugs that are commonly used will include things like cyclophosphamide, which is an alkylating agent, steroids like dexamethasone, and novel agents which include your proteasome inhibitors like Velcade, which is bortezomib, and thalidomide, lenalidomide. So examples of combination therapy usually includes a steroid, a novel agent, and also your Velcade. So Velcade actually causes cancer cells to die by blocking the action of proteasomes. And common side effects of Velcade will include peripheral neuropathy, things like tingling, burning, numbing, weakness in fingers and toes, neuromuscular and skeletal weakness, diarrhea, constipation, fatigue. It can also cause low counts like your thrombocytopenia, neutropenia. And one good thing about Velcade is that unlike other chemotherapy agents, they actually cause very, very little nausea and vomiting. Okay, thalidomide and lenalidomide, they are actually classified as immunomodulating agents. So they work with the body's immune system to fight cancer, and it also prevents the myeloma cells from binding to the bone and forming tumors. Another mechanism of action of these IMiDs are that they block the growth of blood vessels that tumors need to grow, so they shut down the food supply to your tumors and then your tumor will just die. Okay, the difference between thalidomide and lenalidomide is basically lenalidomide was formulated to actually increase the potency of what thalidomide have and reduce the side effects. Yeah. So if we look at some differences in the side effects, not sure if you can see, but you should be able to see on your handout. Thalidomide actually causes more drowsiness, somnolence, constipation, and peripheral neuropathy, which is much less seen in lenalidomide. Although there still is some peripheral neuropathy, constipation, and drowsiness, but much less. But lenalidomide actually causes much more neutropenia and thrombocytopenia. Okay, next we look at cyclophosphamide. It's an alkylating agent, so it actually works by preventing DNA replication and is pairing of DNA and strand breakage. So your cyclophosphamide causes low white cell counts, red cells, platelets, causing the patient to be susceptible to infection and bleeding. It can also cause hair loss. Nausea and vomiting occurs more with high-dose intravenous formulation. So like in SGH, we actually give patients cyclophosphamide orally in tablets. Usually they don't get so much nausea and vomiting. Bladder irritation also more with intravenous use and high doses. So dexamethasone can cause things like your gastric irritation, uncontrolled blood glucose level, insomnia, hiccups, increased risk of blood clots, especially when used in combination with your IMiDs. Okay, so how to manage these side effects? For peripheral neuropathy from Velcade and your lenalidomide, what we normally do in the clinics would be to reduce the dose of your Velcade. So from 1.3 mg per meter square, reduce it to 1, and then to 0.7 mg per meter square. And also by giving it weekly instead of twice a week, the peripheral neuropathy also reduces. And also by giving subcutaneous instead of IV. Other methods would be by giving high-dose vitamin B supplements. They actually help with a bit of, nerve pain. Gabapentin or pregabalin also helps with nerve pain. And some coping tips, just be careful not to fall, because sometimes with numbness on your toes, you don't really feel the floor so well. And to avoid burns. So things like blood clots, there's also a risk, especially with your IMiDs, the thalidomide and lenalidomide, with high-dose steroids. So what we actually use to prevent would be to give you oral aspirin taken once a day after food. And sometimes when you're in the ward, you don't move around so much. We might also give you subcutaneous low-dose, low molecular weight heparin once a day or in the ward. So coping tips will be try not to sit for long periods and get out and walk around. And even if you have to be seated, try stretching your calf muscles by lifting your heels and then move your toes. So if you get low white blood cell counts with Velcade or your chemo, we can actually give you subcutaneous filgrastim or pegfilgrastim to help with your white blood cell growth. Okay, we call it the white blood cell booster. And because if your counts are low, you may be prone to infections, so make sure to keep your hands clean, stay away from crowds or people who are sick and have a cold. And if you have low platelet counts, usually we give you platelet transfusions because the booster jab don't really help with your platelet counts. Okay. And if a patient gets fatigue, fatigue is usually caused by a shortage of red blood cells. We might help by giving subcutaneous erythropoietin to help your body make more red blood cells. However, this may also increase the risk of blood clots, so it's a risk-benefit thing. But of course, we will give blood transfusions if red blood cells is too low. And what you can do is also to eat high-protein food and foods with iron, and try to have enough sleep so you don't feel too tired in the day. Okay, for nausea and vomiting, although things like Velcade have very minimal nausea and vomiting, some patients still do get it, especially with the cyclophosphamide. And if you do get it, we can give you antiemetics to prevent nausea and vomiting. And also, if after preventing you still get it, we can give you breakthrough antiemetics like Maxolon and lorazepam. Now, how I can do is actually also to take the oral cyclophosphamide after food, and that would help with minimizing nausea and vomiting. So other things that don't involve medications would be to avoid heavy meals for 1 to 2 hours prior to and after chemo. Avoid oily and spicy food, especially food with strong odors. Cold food, eat more frequent meals and small meals each time. Eat in a comfortable position and relaxation therapies. Okay, for constipation from Velcade, we can actually give you laxative to help stimulate your bowels. But I know some patients who go outside and buy their own medications. Try not to use too much of over-the-counter medications without consulting a doctor first. And if sometimes the constipation is so bad, your bowel don't move at all, we call it paralytic ileus, then when that happens, then the drug has to be stopped. Okay, what you can also do is to eat high fiber food, drink plenty of fluids, and get some exercise every day. For dexamethasone, because it's high dose, it can actually cause some gastric irritation. So it's advisable to take the tablets after food, and most of the time we actually give you some gastric protectant to go along to take before food. Yeah. Then you take a food, and then you take a dexamethasone. Dexa high dose can also cause uncontrolled blood glucose level, especially for patients who are already diabetic. So for patients who are already diabetic, they might need a higher dose of your anti-diabetic medicine on the day of the Dexa itself. Some patients might. And some might even need a short course of insulin. Some patients get insomnia, especially when they take it late at night. So try to take your high-dose steroids as early as possible, like after breakfast or by midday. But if you still get insomnia, we can help you by giving you some sleeping pills, like the Zolpidem, Zopiclone, Lorazepam. Some patients also get hiccups with high-dose steroids, and we can give you chlorpromazine to help. Okay, for cyclophosphamide, although not so much with the oral ones, it can sometimes cause a bit of bladder irritation, so try not to take the tablets at night. Maintain adequate hydration unless instructed to restrict fluid intake. So by drinking more water, you void more often, and the contact of the metabolite of the cyclophosphamide with the bladder wall is less, so there's less bladder irritation. For high-dose cyclophosphamide, you actually give it together with Mesna. High-dose cyclophosphamide is usually used for mobilization before the transplant. Okay, so for transplant-eligible patients, after we reduce the myeloma load, we will actually collect stem cells using chemotherapy or no chemotherapy, just the GCSF. So if it's chemotherapy, you can include things like a cyclophosphamide or cyclophosphamide with vinorelbine. And then we can admit for transplant and stay for about 4 weeks after. And we will give you a conditioning of high-dose melphalan. And then after that, maintenance, and so on. I think Prof. Chung will talk more about this later. So for transplant-ineligible patients, we give them a course of induction, maintenance, and then if unfortunately a relapse, then we'll have to retreat. So induction for transplant-ineligible patients, right? All the ones that we could use for the transplant-eligible patients can also be used, but the only difference is for transplant-ineligible patients, we can also use this drug called melphalan. Yeah, we don't use melphalan in transplant-eligible patients because it will affect the stem cell collection later on. Okay, so yeah, because melphalan has a toxic effect on stem cells. So things that we can use in transplant-ineligible patients would be Velcade, melphalan with PrEP, or melphalan, PrEP, and thalidomide. So melphalan works by preventing DNA replication, mispairing of DNA, and strand breakage. It can cause low blood counts, nausea, vomiting, secondary malignancies. And remember I mentioned that we actually use melphalan high dose for conditioning. So at such high doses, melphalan can also cause a lot of mucositis, which is the inflammation of your mucosal layer, a bit of toxicity to the heart, and also this hepatic sinusoidal obstructive syndrome. Okay, so other supportive medications that we give in patients with myeloma would be your antiviral antibiotics to help prevent infection. So a commonly used antiviral would be acyclovir, yeah, and in SGH we use this too. And to prevent PCP also we use Bactrim or nebulized pentamidine for patients unable to tolerate Bactrim, allergic to sulfur antibiotics, or patients with G6PD. Okay, so next, just to talk a bit about interactions of the medications with food, herbs, and supplements. So a lot of food, herbs, and supplements, not a lot, but there are herbs and supplements that can interfere with how the body handles the drug and how the drug acts in the body. Okay, so I'll just give an example with Velcade because I believe most patients would be on Velcade. So how the body handles Velcade, because Velcade is actually processed and detoxified by the liver, and is actually very sensitive to other drugs that affect the liver enzymes. So any herbs or supplements that actually block the liver enzymes may actually inhibit the metabolism and clearance of Velcade. So this may actually potentially increase toxicities of Velcade. And if the supplement actually increases the activity of this enzyme, then you're actually wasting your money because it will actually clear off your Velcade faster. Okay. So an example would be grapefruit and grapefruit juice. Not too sure if anyone has heard of it before, but grapefruit juice can also interact with things like your cholesterol medications. Yeah, so it also interacts with your Velcade by inhibiting the liver enzyme, so it can actually increase side effects. As little as 1 glass of grapefruit juice or 2 segments of grapefruit wedges, the effects can last for 24 hours. So you can go and look at that link over there. So we would actually encourage patients to avoid grapefruit juice and check with your pharmacist for other drugs that you're taking. So it's not only grapefruit juice but also pomelo. Yeah, it can also inhibit this. It's actually a CYP3A4 enzyme in the liver. Okay, another thing is St. John's wort. Not too sure what is this called in Chinese. It's a herbal remedy for depression. For St. John wort, it actually increases the process of detoxification, so it reduces the drug levels, and so it reduces the efficacy of your Velcade. So also do not take Velcade together with St. John wort. So many other medications may also interact. Examples will include clarithromycin. Clarithromycin is commonly used in patients when they get upper respiratory tract infections. So, and certain antifungals such as itraconazole. So it's very important to let your doctor know that you're on Velcade. And also when you go to the pharmacy outside, like let's say Gordon Watson, right? You want to get some medications for your cough, cold, flu. It's important to tell them that you're on, chemo, and ask them whether there's any interactions. And also, interaction with how Velcade acts in the body. Velcade acts in several ways to carry out its anti-myeloma activity, and some compounds have actually shown to reduce the anti-myeloma effects of Velcade. So the most common example would be green tea. So I think a lot of people like to drink green tea, right? It has this compound known as polyphenol, and it has shown to reduce activity of Velcade in myeloma cell lines and lines. So if you look at this article, it actually says that when taken together, green tea polyphenols may have a potential to negate the therapeutic effect of Velcade, and so they actually suggest not to take green tea at all. Yeah, because actually if you look at the half-life of Velcade, it's actually really long, and considering sometimes we dose, or rather most of the time we dose it weekly, right? Nearly at all times, our body has some level of Velcade in our body. So I don't think anybody would want to take green tea and then waste your money and negate the effects of Velcade. So yeah. Another thing would be vitamin C. Vitamin C sounds harmless, but at really high doses, it can prevent activity of Velcade. So this includes vitamin C supplements as well as multivitamins containing vitamin C. So it's best to avoid 12 hours before and after Velcade, especially if it's high dose, like 1 gram sort of dose. So what about other herbs and supplements? We're actually not very sure, but Velcade is processed and detoxified by the liver, and many herbs may actually be handled by the liver as well. So it's actually prone to have a lot of interactions. And in the absence of more studies, we would encourage you want to avoid as far as possible, especially all the traditional Chinese medicines, and always check with the doctor or pharmacist before starting. But I know Singaporeans like to take such things, right? Most commonly bird's nest and chicken essence, but I believe bird's nest, I think it's just like protein sort of thing, so bird's nest is okay. Chicken essence is also okay, but nowadays when you buy brands chicken essence, they like to mix it with a lot of cordyceps, ginseng, stuff like that. Try not to take those. Just pure chicken essence should be fine. So another thing would be antioxidant supplements. So some patients like to take coenzyme Q10, fish oil, a lot of things. Yeah, it's okay it's okay in patients who are not on chemotherapy, but in patients with cancer who are taking high dose, especially antioxidant supplements in combination with conventional chemotherapy, to reduce, because there are some people who think that they reduce the side effect of your chemo, but because the protective mechanisms of your antioxidants may not actually distinguish between your normal cells and the malignant cells, so supplements may actually interfere with the anti-cancer activity of your conventional therapies. And not all antioxidant supplements are equivalent, so some actually counteract the free radical activity through multiple mechanisms of actions. There was this large randomized controlled trial that found that the use of beta-carotene and vitamin E supplements in conjunction with radiation therapy is contraindicated and should be avoided until further research is available. And because very few randomized controlled trials have addressed the use of antioxidant supplements during chemo,